Fuller and rounder or higher and perkier? What do I need? A question which always confuses women regarding their breast. Today, let's help you choose. I'm Dr. Mrinalini Sharma, a plastic and cosmetic surgeon practicing in Aestiva Plastic Surgery Clinic, Sagging. Today in this video, we're going to be talking about breast surgeries. Breast surgeries are the commonest plastic surgery procedures opted for by women. So why do women need these surgeries? A nice round breast with a nipple which is positioned centrally over it is the ideal breast shape. So women are desirous of this breast shape as it gives them the confidence to carry certain kinds of dresses. A woman may have a good breast shape to begin with and might lose it following pregnancy and lactation. Or in some cases, even young women might feel that the breast volume is inadequate. Herein comes the role of breast augmentation and also breast lift. So today in this video, we're going to be deciding who needs a breast augmentation and who needs a breast lift, because as I see in my daily consults, a lot of women are confused about actually what they need. So let's decide who is a candidate for which procedure. A breast augmentation is basically a surgery which adds volume to your breast. So the ideal candidate for this would be, say, a young woman who has a good, tight skin. All she lacks is volume. So here, the only concern she has is to add volume to the breast and give it a nice rounded shape. The skin quality is good, the nipple is lying where it should be, that is over the center of the breast. And as I said, overall, the breast has a good shape, all it lacks is volume. So in this case, we're going to be simply doing a breast augmentation. Now let's talk of a woman who is older and in many cases has had children, has breastfed them, and comes to me for a consult. Now when I examine this kind of a woman, I'll find that she has a loss of volume, which is very common, and also along with that, the breast is sagged, meaning thereby the skin is all loose. And another common complaint which these women have is the nipple areola complex, that is the nipple and the brown portion of the breast is all pointy downwards, and it lacks any kind of a shape. So the woman would have difficulty in wearing certain dresses, and she'll tell me that, oh, I don't look good in those bodycon dresses, and this really disturbs her. So these two subsets will require two different treatments. As I said, the first can be tackled with simply a breast augmentation. In the second case, we might require an augmentation also, but prima facie, what this kind of a woman requires is a lift. This brings us to the second question. Just a lift or an implant along with the lift? Many women assume that if I'm undergoing a breast lift, my volume also is going to get better. This is far from correct. In fact, when we're doing a breast lift, we're going to be removing excess skin, we're going to be bringing all the tissue together, we're going to be lifting your nipples, and the breast in fact might look smaller. So if you're a woman who has low volume in addition to saggy skin, just doing a lift won't suffice. We will need to augment your breast by, say, using an implant, or in some cases where you have concerns about fat deposits in certain parts of your body, we can combine procedures and use fat grafting as a method of augmenting your breast also. So it's only your plastic surgeon who can tell you whether just a lift would do or we should look at some form of augmentation. The third question is the recovery. So recovery from a breast implant or a breast augmentation procedure is quite different. So if you're looking in terms of simply an augmentation where I'm using, say, a breast implant or in some cases a fat grafting, the recovery is fairly quick. When you're doing a breast implant, we're giving a very tiny incision either around your nipple or at the base of the breast, and the size is about, say, 3 to 4 centimeters. Yes, of course, if you're using a very large implant, say a 500 to 600 cc implant, then the incision size might be bigger. So maybe I would say that you would be requiring a couple of days of rest, and most women can go back to their activities within a period of 3 to 4 days. But if you're doing a breast lift, then in these cases, the incision is going to be slightly longer, as we can see in the images. So these days, the most common kind of lift which we do is a lollipop incision, which has a circular incision along your nipple areola complex and a vertical limb which is going to extend from your nipple down to the level of your breast crease where your bra strap lies. So it's in the form of a single line and a circle on the top like a lollipop. So Suffices to say that if you're doing a breast lift, then obviously you're going to require multiple dressings. These dressings can be done at home, or the doctor can choose between calling you for every visit for the dressings, or telling you how to manage home dressings in some cases. So in this case, the recovery is going to take about 10 to 15 days. So whatever the procedure you're undergoing, you need to be clear how much, say, break from work you require. So have a detailed discussion regarding this with your plastic surgeon. The last concern which bothers everyone is the scarring. So I'm going to be putting this big an implant through an incision which is just about 4 to 5 centimeters. Again, concealed in your bra strap, not visible to anybody. So I would say that it's a very small price to pay for the kind of breast shape you get. Yeah, if I'm doing a lift, I have a longer scarf, but then again, the shape you get, the lifted perky breast, is again something all women want, and what is actually visible is the kind of shape you get when you're wearing your favorite dresses. So to summarize, both these procedures give great results and have an excellent patient satisfaction rate. If you're looking for any of these procedures, do have a consult with your plastic surgeon, and he or she will guide you best as to what is the procedure you need.